Hi, I am Dr. S.S. Sonani, surgical gastroenterologist. Today I am going to speak about gallstones. So, what are gallstones? Gallstones are stones that are formed inside the gallbladder. Why it happens is usually whenever we eat food, gallbladder has to get empty and it mixes with the food and digestion happens. Whenever gallbladder empties, 80 to 90% of the bile should be emptied. But if it doesn't get emptied in that much, in case patients with the gallstones, usually only 20 or 30% of the bile will get emptied. Remaining 70 to 80% stays in the gallbladder only. Gallbladder is a living thing. What does it do? It absorb the water content inside of the bile and bile get concentrated in stone forms. There are other reasons are excessive cholesterol deposition by the liver. Sometimes certain condition called hemolytic diseases. These will increases the bile pigments and all these causes concentration of the bile and the stone will forms inside the gallbladder. So what will happen? Usually around 60 to 70% of the patients with the gallstones are asymptomatic. Only 30 to 40% are symptomatic. What is symptomatic is usually they present with a pain in the upper side of the abdomen, mostly on the right side, immediately having a fatty meal. They also have pain in the back and this pain will be cramping, usually stays for 20 to 30 minutes, then it subsides. The reason it happens is whenever patient eats a fatty meal, the stone will get slipped and get obstruct its neck. So, and it will prevent further drainage of the bile into the intestine. Because gallbladder is contracting against the resistance, patient will develop a pain. So now sometimes what are the complications of gallbladder stones are? Usually stones are of varying sizes. It can be from millimeter to 1 or 2 centimeters. Sometimes I have seen gallbladder stones more than 2, 2.5, 3 centimeters also. So what will happen when these stones are small, less than 3 millimeter or 4 millimeter, they will slip and they may block the common bile duct. If they block the common bile duct, they develop is jaundice and sometimes cholangitis. The cholangitis is a very serious condition and it requires an emergency intervention. Sometimes these gallstones get further slip away and block the ampulla of Vater. Ampulla of Vater is the part where bile duct and the pancreatic duct enters the intestine. If that area is blocked, and it will cause pancreatitis. Pancreatitis is also a very serious condition. It has various grades from mild to severe pancreatitis. So this is also emergency condition which requires admission, ICU care and some form of intervention. So like when we have to treat a patient with gallstones is, suppose patient is having recurrent pain after having meals, or patient had either cholangitis or a pancreatitis due to gallstones. Sometimes patients are having very large stones, more than 1.5 centimeter of stones, because the larger stones are known to cause gallbladder cancer over a period of 10 to 15 years. That is why whenever stones are big, we advise surgery. And another, we don't advise surgery for asymptomatic patients. Means the patients, we come to know that they have gallstones because of ultrasound done for some other reason, but they never had any of these features. Usually we don't advise the surgery because only 1% of them in a year will develop some form of gallbladder disease. Only then we offer the treatment as laparoscopic cholecystectomy. There are certain conditions where even though asymptomatic gallstones are there, they require surgery. Most commonly they are cancer patients who are undergoing chemotherapy and patients who are actually in the sea travel or who are living in the rig where they have to travel 6 months, 7 months in the ship. In that cases, if they have gallstones and for them taking a health care at the time of emergency is difficult, we will offer them. And patients are having very large stones, we offer the surgery. Even patients with immunocompromised disease like HIV, or some patients who are on prolonged steroid dependent on the steroid therapy, or in the patients with the diabetes. All these patients, if they are having a gallstones, or we expect them to be, when the disease happens, it may become serious. In those cases, we advise the surgery in asymptomatic patients. What is the most common mode of treatment is laparoscopic cholecystectomy. Means there are sometimes patient will ask, sir, you have any medication to dissolve the gallstone? So now they see from past 150 years, people have done varieties of methods. They have removed only stones. They have put the catheter is inside the gallbladder and dissolved the stones, and they have done the ERCP. They have done extracorporeal shockwave lithotripsy. So many options are there. None of them have given a definitive solution. So currently the treatment of choice for gallstones, symptomatic gallstones or complicated gallstones is laparoscopic cholecystectomy. That is a treatment of choice. Suppose if patient has a cholangitis or patient has got pancreatitis, we do a MRCP, and if the stone is there in the common bile duct or at the ampulla of Vater, we do a ERCP stenting, following which we do the surgery. So usually after surgery, like there are certain times only around maybe around less than 2 to 3% of the patients will have something called post cholecystectomy syndrome. Usually what they present is they present fullness of the abdomen. Sometimes they have loose motion, and sometimes they have like very abdominal discomfort. Even most of these can be treated with conservatively with some medication. Sometimes they may require cholestyramine sachets. So 90% of the patient post cholecystectomy, since they are symptomatic, most of body is already adjusted for the non-functioning gallbladder, they won't have any issues following cholecystectomy. So whenever you have a gallbladder stones, before deciding anything, consult your surgeon, then take a calculated decision.